Hey, everybody. Welcome to the Healthy You podcast. My name is Jon. One of the benefits of being not in the media is that we have access to all sorts of cool things inside the hospital, one of which is the emergency department at Evanston Hospital, which is what today's episode is about. Just a quick note, today's episode deals with life and death issues, so keep that in mind for the more sensitive listeners. And here's the episode.
Evanston Hospital. Okay, go ahead.
Hey, can I get some help in here, please?
Hey guys, 67-year-old found down outside the grocery store. First rhythm we checked was a V-fib. We shocked him 3 times, came back, started talking to us actually, and then we got him in the rig and he rearrested. 2 rounds of epi. He's still in V-fib. We couldn't shock him as we were coming right into the ER. Okay guys, let's get the monitor on.
Okay, I'm getting him on the monitor right now.
Continued CPR.
Left cross.
Okay, V-fib. Everyone clear? Clear, clear, shock. Continue CPR. Another round of epi when we're ready. Can someone get a hold of family?
I'll get a hold of family.
Do we have a code status?
Full code.
Reanalyze. Still in V-fib. Charge. Clear. Everyone clear? Clear.
Clear.
Shock. Resume compression.
Welcome to the Healthy You podcast from NorthShore University HealthSystem, where we explore trending topics in healthcare. I'm Carolyn Starks.
And I'm Jon Hillenbrand.
Today we're joined by Dr. Ernest Wang, Chief of Emergency Medicine at NorthShore. Welcome to the podcast, Dr. Wang.
Thank you for having me.
So, I was going to tell you a couple weeks ago, your name came up in a conversation with another physician, and I said something like, you know him, right? He goes, everybody knows Ernie.
I'm afraid to know what they know. As long as my kids get a kick out of seeing, the clips on TV, that's enough for me.
Well, we
and my mom.
Yeah, we appreciate everything you're doing, and obviously what you're doing for our patients. So, how are you doing, by the way?
I'm doing great. I am really, I think, doing great. I know, we had a very sad public story about an emergency physician in New York that
I saw that.
Yeah, she was the chief of their department, and unfortunately she took her life. But I do not feel like I'm in that space because of the people around me. I mean, honestly, the ED staff, the doctors, our hospital, our health system really have provided such support and an ability to succeed that I feel like I have everything I need to get the job done for our patients and for our staff. So I'm very engaged, and I'm kind of in this for the long haul.
Mm-hmm. What does wear on the staff, though, in general, when you think about maybe not just particularly our staff, but and I can't speak to her, but is it that feeling of I can't help them? There's only so much I can do. Is it just the fear, or?
For us, it's the constant unknown. Okay, this new patient coming in, does this patient have COVID? Am I going to get it? Oops, I just touched my nose. Am I going to get it? I'm changing in and out of PPE. That in and of itself is exhausting. If you change in and out of PPE 20, 30 times a shift, it's really tough. And, having the N95 mask on for an hour at a time, or however long some people keep it on for the entire shift, I can't do that. It's tough. So those kinds of small physical things are exhausting. I think when you have a patient come in who has suddenly arrested for whatever reason, and you can't figure out why this 40-year-old person, 50-year-old, 30-year-old suddenly just arrested, those things kind of get to you. Could you have done something different? But I think I won't speak for my colleagues in the ICU, but what I observe is that they're seeing a different type of stress, and also the hospitalists and COVID nurses. And the nurses, this is not a doctor thing. The nurses are outstanding. The nurses are taking such good care of these patients, and I don't feel like they get as much of the recognition as they should.
So how do you guys like working here?
Love it.
Oh, wow.
I wouldn't be anywhere else.
It is true.
No, I know that the delivery sounds sarcastic, but
Work on your delivery, and
Yeah.
then I'll ask you in 20 minutes.
love it.
How long have you worked here?
It'll be 2 years in August. I love it here.
That's a good answer. Your boss is not around here, I don't think.
I love Joan. She's the best manager.
How has COVID been for you?
It's been interesting, but we're all handling it pretty well. I think we're very equipped. I'm sure you saw our COVID bay. And
Yes.
I remember when it was a yellow tent, but now it's like
It's a city.
yeah, it is. It's a,
Yeah. Do you guys use that a lot? Because I haven't seen it used. I just saw it through it.
in the beginning, like in March and April, we were using it every day, but now it's kind of trickling down, but I think we're expecting it to pick back up.
That's the second wave.
Yeah. Yeah.
And what are your thoughts about the second wave?
I'm a little nervous, but I think from what I've seen and how we've handled it, we got this. Yeah.
Well, I would assume they are with the patients the most.
Oh, yeah. Yeah, they know the patients the best. They are exposed more than the doctors are. They are in there fully, sometimes for hours at a time. So the stress that they are probably seeing in the ICU with the kind of chronicity of it, they know what they have, and kind of watching the patients sometimes not surviving, that's a different kind of stress, I think. So it depends on the situation you're in. For us in the emergency department, it's could we have done something different, or there's this reflex to go in and save somebody, and someone comes in cardiac arrest, you start working the patient, and you forget to protect yourself. You forget to put on your N95, you forget to put on the PAPR, or you forget to put the plastic sheet over the patient to protect the staff, and you just go into resuscitation mode. And it's been very difficult to kind of undo that and rewire ourselves to go, wait a second, before we go in, we got to do a timeout. Who's got their equipment on? And if you don't have your equipment on, you get it on. Sometimes it's 5 minutes. That's really hard while you're trying to do this, and you see someone over there who's not breathing, has no pulse. So these things are difficult to rewire. But for ED, and this is a long way to kind of get back to it, I think it's the unknown. That unknown proposition with every patient probably wears on you a great deal.
So COVID has obviously made a big impact on you guys. What's changed for you?
Wearing all the PPE, constant changing of the mask, putting it on, taking it off, is taking definitely a lot of extra time.
What about you?
Well, just always having it in the back of my mind before seeing a patient, and also while talking with them, since it presents so differently for everyone.
Do you have worries or fears that you're dealing with whenever you see new patients and that sort of thing?
Not necessarily. I think, I take as the correct precautions with every patient, and I feel like, this is kind of what I do for a living, and I know there are a lot of people who are worried about it. And I know family members are worried for me, but I guess I try not to think about it.
Right.
I would assume, though, that the ED is used to the unknown.
Yes.
Is it more about the unknown of this virus and how it's going to present? So I might, and of course, your own safety, I guess.
Yeah, it's less about the disease that the patient has. It's more about, is this the one that I'm going to get it from, and am I going to die from it? I mean, really, those are the two questions.
Right.
And if you can't figure out how to intellectually put that on the back burner, you get paralyzed and you can't take care of patients, or you forget about that completely, and then you go into hero mode without protecting yourself. Right. And that person is going to, be exposed unnecessarily, and that person, unfortunately, may contract it. So,
right.
Tell us a little bit about the fear and the courage you see from patients. Because I was thinking about them and I thought how courageous they must be with the uncertainty of how their virus is going to play out in their body.
Yeah, I've been very touched by the patients that I've taken care of with it, and personally. People know what this is. A layperson knows that this can be very serious. You can get real sick, you can get put on a ventilator, and you might die. One patient the other day, I knew she had it just from the way she presented.
What did you see?
It was her oxygen saturation was low,
Oh, okay.
Her breathing was fast, and her X-ray looked like what we call like COVID. There's infiltrates on ground glass on both sides of the lungs, and there's not much these days that can cause all that. And so,
And how long does the typical COVID-19 test results take?
it takes 24 hours. Yeah, there are cases where you just know clinically that's what it is.
Right.
And
what else would it be?
Right. And so we have high suspicion that that's what it is, and so you go with it because it's going to determine how you're going to treat the patient. So I said this nice lady that I'm really concerned you have coronavirus, and she said, please don't let me die. And I said, I'm not going to let you die. None of us are. We're going to take great care of you. You're going to get admitted to the hospital. We're going to give you oxygen. We're going to do all the things that we need to do to keep you comfortable and help you fight this. So there's that range where people, they already kind of see what potentially might happen because of what's in the news. And then there are those that are frankly accepted of the disease. And they go, I know what this is now, and I don't want to be on a ventilator. I don't want anything heroic. And so that is the other, I think, end of the spectrum. And then everyone kind of falls in between somewhere. Mm-hmm. So I've seen great heroism from patients in the face of uncertainty. We don't have a cure. There's no vaccine. There's no drug therapies that have been approved that have been shown to be conclusively therapeutic. So what we have is hope and reassurance, and we have to kind of go back to some of the essence of being doctors and nurses and healthcare workers.
How do you convey that when you have the mask on and the protective equipment, sometimes maybe even a shield over your face?
Yeah. You have to use your eyes, and you have to use your tone, and you have to use your hands. Hold their hand. You have to kind of look at them and be able to convey with those things what you want to say. And I know this has been called like an invisible virus by a lot of people, but it really is not invisible to anyone who's taking care of a patient with coronavirus. You can see it in their eyes. You can see when they're fearful. You can see when they're concerned, and you can see. It's called the general appearance. You can clinically just look at them and go, okay, you have it. So so there's a face to this that every healthcare worker has seen in some shape or form. So yeah, you got to use your eyes. You got to use your voice, and the reassurance that you deliver in your voice is, I think, and just by holding their hand, it's really important.
When I was taking photos in the ICU a couple of weeks ago, I saw two nurses who were holding the hand of a patient and really spending a lot of time. And she was on a ventilator, and they didn't think that she could talk. Seeing, like you said, seeing the nurses and how they're able to accomplish their jobs and be so caring is just really inspirational.
Because no one else can, right?
Right.
This is completely different. There's no visitors. Okay, people are dying alone, so you cannot replace that. And so the nurses doing that, the doctors being able to do that, to be a surrogate family member or a conduit for the family is really, right now, probably the most important thing that we can provide.
This is my fourth shift.
Fourth shift as in, when did you start?
July 1st.
Oh, wow. So really recently.
Yeah.
Is this brand new job for you?
This is a brand new job.
And what is it like? I mean, because you're coming into this environment with COVID and it's an emergency room.
Yeah. So I went through medical school, matched into emergency medicine, applied for emergency medicine, and now I'm an intern at University of Chicago in the emergency medicine department. So I knew what I was signing up for. Nobody really expected a pandemic, but that's what we got.
I think when we look back at this in a few years, a lot of good will have come out of this in the way that we think about our essence of, as a healthcare system, what are we actually doing? How can we provide care to the patients where they're at? And the current paradigm is go to the doctor's office, and if you don't get to the office, you can't get seen. Well, we know that there's a lot of things that you can do differently now, right? And so, home pulse ox monitoring is a great example of that. And I think for a majority of patients, this is going to be a strategy that we're going to need to use as a discriminator for who needs to come to the hospital right away or not.
Right. We're getting glimpses of this intense drama that normally are reserved for like TV shows or such.
ER, yeah.
Right. And then if you have sort of like a scare of getting it or someone who thought they had it, and you kind of feel that fear, and then you realize what all of you are doing every day, facing it every day, and I'm worried about going to the grocery store.
Yeah, well,
it's
understandable, but I think, some people say I didn't sign up for this, and I'll probably say I didn't sign up to risk my life every day, but if I have the tools I need, and, our armors, our PPE, and our kind of weapons are hand sanitizers and washing your hands and cavi wipes, and if we have the means and the ability and kind of all the other protective gear, the PAPRs and everything to be able to do our job, that is a comforting sense to have. It is empowering, and you're right. What you said about the TV show thing, we would always kid ourselves that ER is not really like the show, right? But in the first couple of weeks of this, when it was totally unknown, when I'm going to walk in this room, I'm going to come out and get sick and die. It was kind of like the show, and you're like, oh my God, you walk in, you're like, okay, is this, am I tucked in right? Is this little piece of skin covered up? And I got to make sure. And then taking it off is even worse, because you don't want to touch it and mess up and scratch your face, and oh my God, I just breathed it in. So all of those things, once you kind of have gone through it, there's no other way to explain it. You have to survive it, and once you've survived it, you kind of relax a little bit, and then it becomes just a daily routine on how to
this
just
is
to
the
be
new
safe.
normal.
This is the new normal. It's not going away, and I don't think we should think about going back to the old way.
So hi, I'm John. What's your name?
Emily?
And you have a unique perspective, Emily, because someone told me that you are coming back from being sick.
Yes.
So you just went through the employee screening process and all that. What was that like?
So we get screened every day before we come into work. We have to fill out an employee questionnaire. And I had a sore throat for a few days, and I was pretty confident that it was allergies, but also really didn't want to be the person that wrote it off and gave half our staff COVID. So I answered yes to one of the questions, which was, do you have a sore throat? There's a laundry list of symptoms, and if you answer yes to any of them, get a call from employee health, and they decide if you need to be screened for COVID, and they decided I did need a COVID test, so got a COVID test. It was negative. Wasn't allowed to work for a week anyway, which, watched a lot of Dexter. It was fine.
Nice.
And that was basically it. Yeah, I think working in the ER, if you say yes to any of it, they just automatically assume you have COVID because we have so much exposure to it.
Right.
But
well, now you can get a negative antibody test.
I've already had a negative antibody test.
Oh, there you go.
Well, the thing is, I'm guessing you have to remind yourself, or maybe not, that you can't let your guard down, though. Even though this is the new normal, you really can't.
Right.
You don't know what's coming through.
Right.
And protecting yourself is just as important, or maybe even more important, than assisting a patient in need, because if you go down, there's a lot of other people depending on you.
Right. That calculus has changed. We have to protect ourselves in order to protect the patients.
Right.
And it's really important. And I think if we focus on one thing as an organization going forward for our patients is safety, protecting ourselves and our staff. And the patients will respond to that. They will see that, right? If they see that we're taking precautions to protect them, their families, and ourselves, that will come through. And eventually, once we kind of ride it out, we'll be in a better place because we'll have ingrained these habits of sanitary practice and teamwork. Just so many things I think have come out of this that we can use as positive lessons.
The teamwork thing seems like it's a common thread with all the people I've been talking to. Yeah. So, do you think that really helps when it comes to facing a crisis?
Yeah, any type of crisis. I mean, whether it's you have a psych patient or a cardiac arrest or a crisis of a new global pandemic. I mean, we're in it together. You never feel alone here. It's good.
I use this example because it really crystallizes everything about COVID-19 right now for me. Is my babysitter's husband came down with COVID about a month ago now, a little over a month ago. And he was sick at home, and I was working at Skokie in the emergency department, and my colleague calls and says, this person that he's here. And I'm like, what day is it? And he said, day 10. All of a sudden, I'm sure the color just dropped down my face, because usually, our experience is somewhere between day 7 and 10.
Oh, they take a turn.
They take a turn for the worse, and they get really sick. And so I kind of finished up what I was doing there and came right over here and saw him, and he was actually very ill. And so, we had this visitor policy of no visitors on the floor, but at the time they were working. Ashley Chambers, God bless her, on the COVID floor here of having one visitor come in. So we worked it out so that I could bring this person here to see her husband while he was still awake and alert. That was probably the most valuable, left the greatest impression on her about her entire interaction with our health system. Every time I see her, she just continues to say on and on. She was so grateful for the opportunity to see him. And if they'd gone to any other hospital or health system, that probably wouldn't have happened. So when we think about kind of what our patients think about the organization, is these kinds of things that matter so much more than sometimes, the medication, the things that we do. The nurses become surrogate family members because only they can hold their hand. That's really just was a very profound moment in realization, and it kind of changed the way that I have thought about how we do this for our patients.
You talk about holding a patient's hands, but again and again, it's not just this one time.
No.
Which I can't imagine the resilience someone would have to be that surrogate family member,
And the stakes are a little not higher per se, but they're more dramatic and they're more pronounced because of how quickly patients can turn, and all of a sudden you're looking at hours,
Yeah.
And I think just with the connotation of contagion, it takes a different type of seriousness too, because in that symbolic thing of holding someone's hand, you're risking your life by touching this person. You're obviously protected, but you're giving something of yourself to comfort this person with the only thing you have. The other thing I wanted people to know, it's okay to not feel okay through this. It's really important to acknowledge that you're going to have days when this really bothers you, and you have downs, and you hear about bad things, and you hear people dying, professionally, personally, and it's okay to not feel okay, and know that other people are feeling that way too from time to time, and you're riding this wave just like everything else. And to know that if you're in that space that you should reach out, you should feel comfortable reaching out to your colleague, to your friend, to your confidant, whoever it is, because if you don't allow that to resolve, and it just keeps getting buried deeper and deeper, and all of a sudden you've dug yourself a very big hole, and you can't dig yourself out of it sometimes. So that's very, very important, I think.
Absolutely.
So this interview was a great opportunity for us to check in with Dr. Wang and his staff. We want to thank some of our other colleagues in the emergency department that helped put this together.
What's your name?
Ben Feinzimmer.
Thank you, Dr. Feinzimmer.
With an F, not a PH.
And he's our EMS director, so this is great.
Perfect. Can I get your name?
Oh, Mary Lou Carroll.
What's your name?
Lauren Goodell,
What do you do?
PCT.
PCT. And what about you?
Kelly Johnson, PCT.
My name's Joan Casey. I work in the ER at Evanston. I'm a nurse.
Agatha Lewandowska. I'm a nurse.
Sandra Coker, emergency medicine intern.
I'm Natalie. I'm a nurse in the ER.
My name is Emily, and I work in the ER at Evanston Hospital.
FLOY DeLuca. I'm one of the nurses.
Kathy Romano, nurse in the ED.
Oh, Anne. A-N-N-E. Beck. B-E-C-K. I am a nurse in the ER.
It's Ina Slobodyan.
Very cool. And what's your role here?
I'm a registered nurse.
Thank you.
Thanks.
You're a good interview.
Oh. Did you hear that? I did.
It's nice to hear all those different personalities. You can hear them in their voices. I really like that. So what's coming up in our next episode?
Our next episode is going to be the race for a vaccine, and Dr. Nirav Shah, an infectious disease doctor, is going to lay it all out for us.
Allow me to talk about this. I think this is in the minds of everyone. I mean, any data that comes out, the entire stock market kind of goes up and down based on COVID therapeutic and vaccine data.
Yeah, that's coming up in a couple of weeks, days. I'm not sure. It's coming up soon.
It's when we get it done, so thanks for asking.
When's that coming out?
Yeah.
When it's done. So we'll have that coming out probably in a week or two. So if you're not subscribed, you should subscribe so you can keep track of when all the new episodes come out.
You've been listening to the Healthy You podcast from NorthShore University HealthSystem. Stay safe, wear a mask, and thanks.